Thank you for joining us. I'm Mark Hanrahan.
And I'm Jane McCarthy. First up tonight, the measles outbreak in Washington state is now up to 37 confirmed cases. That is 2 more compared to yesterday. Washington state lawmakers are proposing a bill that would ban personal exemptions for the measles vaccine. Right now, vaccinations are required for school-aged children.
But state law allows parents to easily opt their children out of certain vaccines for medical, personal, or religious reasons. Washington is one of only 18 states that allow personal exemptions. This particular bill would only apply to the MMR vaccine, which vaccinates against measles, mumps, and rubella. With the possibility of some cases coming to the eastern part of the state, doctors are advising parents on how to keep their children safe.
KREM 2's Shayna Walltower spoke with a local epidemiologist on what you can do to keep them healthy.
Classrooms, daycares, playgrounds, they're all places that children come to fairly often, if not every day. But because of the number of children that come to these areas, there are also a likely chance that they could get the measles from these areas.
Measles is a disease of opportunity, so if it gets introduced into a population where there are susceptible people, then you have the potential for an outbreak.
Measles is a highly contagious viral disease most known for its spotty red rashes. While adults aren't excluded, it's most common in children. And with the disease possibly making its way over to eastern Washington, doctors are highly recommending that parents get their children vaccinated.
Our biggest call to action to families is to make sure that they are vaccinated against measles and make sure their loved ones are vaccinated against measles if they can receive the vaccine.
Measles symptoms can start with fever, runny nose, cough, red eyes, and a sore throat, then followed by a rash, usually on the face. The measles virus can last in a room for up to 2 hours, meaning a child doesn't have to come in direct contact with someone who has the virus.
The measles vaccine is extremely effective. So with 1 dose of MMR vaccine for the measles component, it's 93% effective, and with 2 doses, it's 97% effective.
Now, doctors recommend that children receive the MMR vaccine when they turn 1, but they can get vaccinated as early as 6 months old. They'll still have to get the full 2 doses after they turn 1. Now, if you have children in daycare, you'll want to call and see if they require all of their children to be immunized. Licensed providers are required by law to keep a record of children that are and aren't vaccinated. And as always, encourage your children to wash their hands and clean any surfaces that may have come in contact with someone who was sick. Shayna Walltower, KREM 2 News.